What if we told you that the biggest health crisis in America isn't physical, but mental? This isn't a question to be taken lightly. It's a call to acknowledge a crisis that has been looming over us for far too long, a crisis that is as real as it is invisible. It's time we shed light on the urgency and severity of the mental health crisis. We're living in an era where our minds are under siege. The rising rates of depression, anxiety, and suicide paint a chilling picture. Imagine a country where 1 in 5 adults grapples with a mental health condition in any given year. Picture a society where the second leading cause of death among young people is suicide. This is our reality. Yet, despite these alarming statistics, mental health is often sidelined, misunderstood, and stigmatized. The mental health crisis in America is real, and it's time we start talking about it. Hear from those who witnessed the crisis firsthand, our mental health professionals. Every day, they are on the front lines, navigating the turbulent waters of the mental health crisis that's sweeping across our nation. Their stories, their experiences, their insights, they all paint a vivid picture of a battle that's far from over. From the bustling cities to the quiet rural towns, they've seen it all. They tell us about the surge in people seeking help, the lines that are growing longer and longer. They speak of the overwhelming demand for mental health services, a demand that is rapidly outpacing the resources available. They share their concerns about the lack of adequate funding, the shortage of trained professionals, the outdated facilities. They highlight the need for a robust, responsive mental health infrastructure, one that can effectively address the complexities and nuances of mental health issues. They talk about their patients, individuals from all walks of life, each grappling with their unique struggles. They speak of the heartbreak of seeing their patients suffer, the frustration of being unable to provide the care they so desperately need. They recount stories of resilience and courage, but also of despair and hopelessness. They are not just healthcare providers, they are also witnesses to the human toll of this crisis. They see the strain it puts on families, the impact on communities, the ripple effects that touch every aspect of society. And they worry about the future. They worry about what will happen if this crisis continues to be overlooked, if the pleas for help continue to go unheard. They worry about the rising tide of mental health issues and the devastating consequences if we fail to act. They are the voices from the field, the voices that echo the harsh reality of the mental health crisis. Their experiences, their insights, their concerns, they all underscore the urgency of this issue. As you can hear from our professionals, this crisis is not just numbers and statistics. It's about real people suffering every day. Now that you've heard the reality of the mental health crisis, what can you do about it? It's a daunting question, but the answer lies within each of us. You hold the power to make a difference in this dire situation. The first step is to advocate for mental health policies. Be the voice that promotes change. Write to your local representatives. Use your social media platforms to raise awareness. Let the world know that mental health is not a stigma. It's a reality that millions are facing every day. Next, consider supporting mental health organizations. Your donations can help provide resources and services for those in need. And lastly, start the conversation about mental health in your own communities. Break down the walls of silence, encourage open discussions, and let's remove the stigma together. The mental health crisis in our country needs your attention. Don't turn a blind eye. Act now and make a difference.